Hi, welcome. I'm Sean Roll. I'm an associate professor here in the Division of Occupational Science and Occupational Therapy at the University of Southern California. And I'm going to share a little bit of information from some data we collected this past year with individuals who had transitioned to working from home during COVID-19 in an attempt to kind of understand that transition in the relationship of the home workspace to individuals' health, well-being, and productivity. So a little bit of background. Really, we know that the workspace and the work context is really important in shaping somebody's experience and their identity of who they are, and their satisfaction is driven by, or their productivity can be driven by their satisfaction in the workplace, and really this can relate to their overall health and well-being. Most of the work that's been done in trying to understand working at home has been looking at the boundaries that occur between home life and work life. This has long been studied and it's a really important area, but most of these studies have been focused in looking at individuals who have intentionally stepped into working from home. And it's usually a small group of individuals who working at home makes sense for them because of their job duties. The pandemic created a really unique situation and an opportunity for us to really study and understand these concepts across a lot of different jobs and occupational categories, folks that don't typically work from home, and in individuals who, for better or worse, didn't have an intention of actually working from home. So what we did was we launched an anonymous online survey, primarily in May of 2020, towards the front end, of course, of the pandemic and stay-at-home orders. We were really interested primarily in understanding impacts on health and well-being, and then productivity and performance of their work roles. So we measured those things in a few ways. We had two relative scales for well-being, for physical and mental well-being on a 1 to 5 scale, with 3 being the mental and physical well-being similar to the pre-pandemic levels, 1 being much worse and 5 being much better. And similarly, productivity, 3 being productive as before, and 1 being less productive, 5 being more productive. We also asked people to provide us with new health conditions that they had, and to tell us a little bit of how many hours they were spending at their computer workstation. We then looked at characteristics of the workers, the home environment, their health, well-being, and other factors of the work to really understand the things that might be contributing to or predictive of these changes. We received about 1,400 responses to our survey, 988 of which were valid responses, complete. The average age you can see was about 40 years old, primarily female Caucasian, and the sample was a little bit different from our typical working population. Higher education, graduate and doctoral degrees, you can see 2/3 of our sample, and medium level income, 50 to 150,000 as an income level. Across the different jobs, we had folks in the business office, engineering, and education areas primarily, with some of the other sectors being less represented. We're not sure if this was due to our sampling method, where we started with our known networks and used snowball sampling, or if this was also representative of individuals who actually were transitioning to work from home. Folks in the service and physical industries probably likely aren't as easy to transition into working from home situations anyway. So this was the breakdown. We also, due to our sampling, likely had an overrepresentation here, you can see, from California. However, we did get the other major population centers in Chicago, New York, Texas, as well as some other areas in the northeast of the US. And we had a few responses from outside of the US. Most of the individuals here were living with other adults. 84% of individuals lived with someone else. 50% of people had pets, and then varying amounts of other children or dependents in the household. A third of individuals had a dedicated office where they were doing their work. About half the individuals set up a space. I did that myself, set up at my kitchen table with a workstation. And then 16% of people were working in a variety of places. In regards to their health and well-being, most people reported slightly decreased physical and mental well-being from the pre-pandemic level. These were rated about 2.7, 2.8, again, with 3 being about the same as before. However, some of the different activities and things had changed. People were reporting on whole across our sample less physical activity and exercise, and more overall food intake, although the balance of junk food and healthy food seemed to be about the same across our sample. When we look at these different factors and the interrelationship among the factors, of course, we would expect to see the relationships within physical activity and exercise, as well as some of the food levels. However, when we look to our primary outcomes of physical well-being, we do see that the physical activity and exercise was positively correlated in a moderate way. So more physical activity and exercise was also related to better physical well-being. And then with food intake, again, healthy food intake seemed to be moderately correlated with better physical well-being, whereas overall food intake was negatively correlated. There were no relationships with junk food to physical well-being, and mental well-being was only related to the physical activity and exercise levels. Again, at a moderate level with that positive correlation, no relationship to the food intake itself. However, across all individuals, you can see there was a huge percentage of people, 2/3 to 3/4 of reporting new physical health issues. And actually about half, 50% of people reported 2 different health issues. When we look at the factors then that related to 2 or more health issues or mental and physical well-being in our modeling, some of the most significant findings we see here, again, these physical activity, exercise, food intakes are in the directions that we would expect to see. But when we start to look at other things in the environment at the work from home, we see some interesting kind of things pop out. Firstly, teenagers, toddlers, and infants. Teenagers actually was protective. Having a teenager in the home was protective of having multiple mental well-being issues. So that was the inverse of having a toddler or an infant in the house, which actually increased or was very predictive of people having more mental health issues, anxiety, stress, those sorts of things. The distractions, work communication, you can also see here somewhat what we would expect. Work communication itself actually was in the opposite direction, however, of leading to more problems for people who actually had increased communication with people at work. The actual physical environment, satisfaction with the visual, thermal, air quality, and noise seemed to be protective and supportive of individuals not having any sort of injuries or decline in their health status. But most importantly here, when we look at those that had the dedicated office spaces versus shared or a variety of office spaces, you can see a huge difference. Those that worked in dedicated offices in their own homes tended to have a protective effect against all health conditions. Whereas when we look at people that were moving around their house, so you can imagine the people with their laptops, sitting on the couch, sitting at the kitchen table, sitting in different places, these were individuals who also reported more physical and mental health issues, onset of new issues throughout their work. And similarly, sharing the workspace with others. So being in a common area or having other people floating in and out of the workspace, those things tended to have a relationship to an increase in physical and mental health issues. When we look at the work specifically, we saw that across our sample, again, productivity was about the same as it was before. So in general, this shift to working from home didn't seem to change people's perspective on how productive they were. However, there was a significant increase in the number of hours that they were sitting at a computer workstation. Across the sample, this actually averaged out to be about 1.5 hours more sitting at a computer workstation than they were previously at their workplace. Other things that we saw increase were distractions during the workday and expectations of their workload throughout the workday. Things that we saw decrease were communication with coworkers. Most surprisingly, and maybe the positive thing here, is that overall, all of the satisfaction ratings for the physical environment were quite high. So the thermal environments, visual environments, how satisfied people were with working in their home environment seemed to be high in general. Across the different categories, there were differences in the job classifications as far as how productive people were and how many additional hours they were spending at the workstation. When we look at the relative productivity as compared to prior to the pandemic, working in their normal office settings, traditional settings, we can see that most of the groups, first 4 groups here, didn't have too much of a change, but we see a decrease in the overall rating of their productivity for healthcare and service occupations, and an increase in those that were working in basic science. From the hours at a workstation across the sample, again, there was primarily an increase in the number of hours for pretty much everyone. But the most significant increase in the hours here you can see is the education and healthcare sectors that were spending 2 to 2.5 hours more at their workstations when they were working at home. And this mostly makes sense. These are educators, teachers, clinicians who primarily in their regular work settings were interacting with students, interacting with clients, those sorts of things. And now they're sitting doing their teaching via Zoom, or they're interacting via telehealth and those sorts of things. So this is probably to be expected, but is a fairly significant increase, half an hour to an hour longer than what most people on average were doing. The things that were mostly related to these two components in productivity. Again, we saw infants and teenagers showing up here. Those that had infants in the home were the group across all of our ratings that had the lowest relative productivity rating, a 2.39. Those with teenagers actually seemed to indicate they were slightly more productive than prior. Hours at the workstation, again, everybody had an increase, but those with infants and toddlers had a much smaller increase than the sample at about a half an hour to 3/4 of an hour longer. Those individuals, again, who had an office desk, a standing desk, adjustable chair, or equipment to support their work, tended to work longer, so approaching about 2 hours versus the 1.5. And then teenagers, school-age children, and dependent adults also, those individuals were working longer at a workstation. Across our modeling, things that came out to be significant here, as we mentioned, infants and other distractions, those things, of course, decreased productivity, decreased the number of hours that were spent at the workstation. People in the health and social services, again, had increased hours at their workstation. However, they also tended to report decreased productivity compared to the other groups. Mental well-being, those that had better productivity also had better mental well-being. So that's an expected kind of relationship we would expect. And hours at the workstation tended to be lower for those that had better well-being. So they were spending less time at their workstation. Thermal environments, communication with coworkers, workload expectations, all of those things tended to increase people's perception of their productivity and workload expectations, and people who adjusted their working hours from their previous hours in some way, so different hours of the day, different days of the week, all tended to work longer at their workstations. So across all of these data, I think there's some interesting things that we've seen here. So first and foremost, of course, this transition to working from home and contextualized within a pandemic really led to declining health or health concerns across almost everyone in our sample in some way, shape, or form. People were working longer at workstations, sitting at their workstations, but maintained similar levels of productivity. Importantly, I think to point out is that having dedicated workspaces, other equipment, those things were really supportive of people's health and well-being, as well as increased hours. And those that had to work around in a variety of places or share their workspaces were really those that were at the most risk for problems. Similarly, having a good visual environment, thermal environment, other things, those things seem to be protective and supportive productivity as well. Other things to kind of consider here were maintaining communication with coworkers and avoiding distractions. Seeming to be good things to support work. And then people in the house, teenagers, for some reason, seem to help promote health and help promote productivity. And as one might expect, infants and toddlers were more detracting. So across all of this, really what we are hopeful is that this information can help workers, can help companies and businesses who are really looking to make decisions about the future of work. And are people going to be continuing to work from home? And if so, there's some things that need to be considered, in particularly equity across individuals, those that may not have resources or have workspaces that they can set up their home office environments in a meaningful way, or have good control over the thermal and visual environments. These are important things for companies to consider, as well as childcare and how do we maintain communication with coworkers and some of these more social types of things. So hopefully our information provides, this data provides some information to move the field forward in a more meaningful way. There's 4 publications that we now have out on the topic, so I encourage you to go and read more about this. We have another one that we're working on very specific to the visual thermal environments and the health conditions that we're hopeful to have out soon. And if you haven't already, I would encourage you to look up the other symposium session by Yoko Fukumura, who is going to be talking about some of the qualitative comments that we received, qualitative analysis of the comments we received from our participants regarding the transactional nature of time use and space and place. And then my email and contact information is there. And I hope to be available during the morning discussion session at the symposium and also potentially at the evening session as well. So thank you very much. And I look forward to hearing more from you.